Nasopharyngeal carcinoma is a rare and often aggressive type of head and neck cancer originating from tissue of the nasopharynx. The nasopharynx is located above the throat and behind the nose, with openings on either side leading to the ears. While symptoms may vary and can often be difficult to detect in the early stages, common signs may include a lump on the neck due to swelling of the lymph node, ear and throat pain, bleeding of the nose, and general difficulty breathing, hearing, and speaking. More advanced symptoms include headaches and facial numbness/weakness. In 2018, Globacon estimated the Asian population to account for 84.6% of new cases of nasopharyngeal carcinoma worldwide, equating to 109,221 affected individuals. This significant incidence is due to its unique geographical and ethnic distribution, in addition to prevalent etiological factors, including Epstein-Barr virus and human papillomavirus infection, increased salted fish consumption, and genetic susceptibility of the population. While chemoradiotherapy in conjunction with multi-drug combinations, commonly involving cisplatin, may be effective in early-stage therapies, their use is often accompanied by significant toxicity to the patient and development of cisplatin resistance. Furthermore, median overall survival is limited to only about 12 to 15 months in distant metastases following platinum-based treatments. So, despite its prevalence, nasopharyngeal carcinoma is clearly not so simple to treat. But what if we told you that the solution to this problem may lie within using naturally derived compounds from plants? Well, this is exactly what a growing body of research is exploring, not only for nasopharyngeal carcinoma, but for various other cancer types as well. This was demonstrated by Liu et al. 2020, who investigated the cytotoxic effects and mediated mechanisms of Asiatic acid, a pentacyclic tridipene derived from the tropical plant Centella asiatica, in cisplatin-resistant human nasopharyngeal carcinoma cells. In this study, they highlight how this effective and less toxic anti-cancer agent significantly reduces cell viability of cisplatin-resistant nasopharyngeal carcinoma cell lines, cis-NPC39 and cis-NPC-BM, in a dose and time-dependent manner. It does so by inducing both extrinsic and intrinsic apoptotic pathways.
The MTT cell cytotoxicity assay was used in this study to determine the cell viability of human cisplatin-resistant NPC cells based on their metabolic activity in response to various treatments of Asiatic acid. This non-radioactive colorimetric assay is based on the reduction of yellow MTT salt by mitochondrial dehydrogenesis in metabolically active cells to form purple formosome crystals. These are then dissolved using a solubilization solution, and the absorbance of this solution is measured using a spectrophotometer. The amount of color produced is directly proportional to the amount of metabolically active viable cells. This technique is broadly used in measuring the cytotoxic effects of various drugs on many cell types. Briefly, in the study, cultured cells were treated with various concentrations of Asiatic acid and incubated with an MTT reagent at 37 degrees Celsius for 4 hours in 5% carbon dioxide. This was followed by the removal of the supernatant and addition of DMSO to dissolve the purple formosome crystals that had formed. Absorbance values were measured by an ELISA plate reader at 595 nanometers. Each condition and experiment were performed in triplicate. As shown, the wells with darker purple colors corresponded to greater cell viability as reduction of the MTT reagent by mitochondrial dehydrogenesis occurs only in metabolically active cells and to a greater extent with increased cell viability. The MTT assay is a simple, versatile, and effective method to measure cell viability that replaces many other more complex radioactive techniques. However, despite its wide use, the MTT reagent itself exhibits cytotoxic effects that can be damaging or even kill cells during an experiment. This potential interference may reduce the accuracy of cell viability measurements. Furthermore, in the context of this study, this technique does not describe the mediated mechanism by which Asiatic acid induces cell apoptosis. This is addressed within the study by further experimentation with more advanced molecular techniques.
Through the MTT cell cytotoxicity assay, Asiatic acid was found to significantly reduce the viability of cisplatin-resistant nasopharyngeal carcinoma cell lines, cis-NPC39 and cis-NPC-BM, in both dose and time-dependent manner. As shown in this figure, the reduction in cell viability is most significant with Asiatic acid concentrations of 50 and 75 micromolar, and to a greater extent after 48 and 72 hours of exposure. This cytotoxic effect of Asiatic acid on cell viability is consistent, irrespective of the presence of cisplatin, indicating its effectiveness against these resistant cell lines. Asiatic acid reduces cell viability in these nasopharyngeal carcinoma cell lines by inducing apoptosis through both the intrinsic and extrinsic pathways. This includes its ability to alter the mitochondrial membrane potential, activate death receptors, and upregulate Bax and caspase expression. Further experimentation using Western blot analysis revealed the MAPK pathway, in particular the phosphorylation of P38 protein, is a key mediator in the Asiatic acid-induced apoptosis of these cell lines.
The particular significance of this study lies in its contribution towards the research and development of alternative treatments to cisplatin-resistant NPC, using naturally derived compounds, particularly focusing on Asiatic acid. This is crucial as more conventional cancer treatments, such as radiation therapy and chemotherapy, are accompanied by numerous negative side effects. It also contributes to the comprehension of AA molecular processes in the treatment of cancer, in a context where resistance to conventional therapies is a significant challenge. This aligns with a broader trend in oncology research that looks into potential therapeutic properties of natural compounds, thus establishing a stronger foundation for further research and investigation of effective anti-cancer natural treatments. Contribution to society include improved cancer treatments, offering an alternative therapeutic option for cisplatin-resistant NPC, thus higher survival rates, greater quality of life, and reduced suffering. Potentially less invasive in comparison to other cancer treatments such as chemotherapy and immunotherapy, allowing less disruption to patients in terms of physically and mentally. Lastly, public health impacts, overall lowering rates of morbidity and mortality via fewer treatment-resistant cancer patients. This study is limited in its scope by only investigating the impact of AA treatment on cisplatin-resistant human NPC cell lines. This limitation is, however, remedied by the growing body of research surrounding AA effect on other cancer cell types. Similarly, AA has very poor water solubility, which limits its clinical use due to difficulties in administration and absorption. To overcome this, researchers incorporated AA into RGD-containing solid lipid nanoparticles, optimized with specific lipids. These are then characterized to ensure that they have necessary properties for effective drug delivery. According to Kasemi, inconsistencies of the results also exist due to technique limitations, such as viability assay issues and measurement challenges. As this method relies on dye that changes color dependent on cell metabolism, at times unwanted factors affect the dye's reaction, leading to inaccuracy. Similarly, inconsistencies in certain parameters measured in various AA studies poses a challenge to the ability to accurately compare results across various research articles. This, as such, optical density values can vary between studies, making it difficult to draw clear comparisons between articles. Due to its reduced toxicity and anti-cancer properties, AA offers optimistic implications for the future development of effective alternative therapies for cisplatin-resistant NPC. Furthermore, the study establishes a stronger foundation for further research on the mediated mechanism by which AA, among other naturally derived products, may induce apoptosis and cell death in NPC cells, amongst various other cancer types. This can be utilized to develop more effective therapies for a broader range of cancers affecting different cells.